Hello, I am Amos Ritter and I'll talk about external and internal realities in Balint groups. Many countries in the Western world are in transition from a social to a capitalistic economic system. Countries like such as the USA, Chile, Great Britain, Hungary, and Israel now have a regime which supports private industries and condemns social approaches. The world is in transition from liberalism to individualism, nationalism, accusation of foreigners, and hate. The medical system reflects this change. People react with fear, anxiety, feelings of insecurity, and worries about the future. Increase in traumatization of minorities, leading to more health and health related problems. Increase in the need for healthcare, especially to treat emotional and psychosomatic manifestation of persistent stress. Healthcare providers are under pressure due to increase in demand and the emotional burden of treating patients with these symptoms. The COVID-19 epidemic is putting extra pressures on both patients and doctors. The fear of the disease causes both to avoid physical interactions, moving to less personal, digital interactions. The patient is afraid of the doctor, of acquiring the disease at the doctor's office, and the doctor is afraid of the patient who may transmit the disease to other patients or to the doctor himself or herself. Doctors who work with COVID-19 patients are in a constant dilemma between their duty towards the patients and their responsibility towards their own health and the health of their families. Governments use the epidemic to increase their control of the population. For example, the Israeli government has made a new law that allows its secret service to use cellular data in order to know the exact location of every person at any given time. This way, they can instruct individuals to go to quarantine if they are exposed to a COVID-19 carrier. However, the people became suspicious of their government, wondering if this data might also be used for other purposes, e.g., political. Countries are closing their borders to avoid COVID-19 transmissions from other less clean countries, again increasing the level of fear from foreigners. There is a constant fear of becoming exposed to or sick with COVID-19. How will I survive the disease? Will I transmit it to my loved ones? Will they survive if they get sick? Will I feel guilty if they don't? All these external factors causing strong emotions such as fear, anxiety, loneliness, and distrust are common in patients and doctors alike. They are brought into the Balint groups, and their influence on the doctor-patient relationship is prominent. So several questions arise. Should Balint group leaders allow these issues to become so dominant in the group process? Is it possible to deal with doctor-patient relationship as sterile, omitting the external factors that influence them? Can Balint work help healthcare workers cope with these changes? Can we help to improve the resilience of healthcare workers? Can or should we take part in an attempt to change the situation? Some people say that it is impossible to deal with the internal reality while there are such strong external pressures that demand all our physical and emotional energies. So how aware can stressed and anxious physician be of their feelings? I believe that Balint group work cannot be sterile. It is impossible to ignore the external factors that accompany us when we enter the group room, be it physical or virtual. However, we should try to concentrate not only on how this external burden makes us feel, but on the effect it has on our relationship with our patients. This differentiation is not always easy to achieve, since the feelings that the external pressures evolve are very strong in both patients and doctors. But if we succeed in this mission, we may find that going back to the roots, our relationship with our patients, may help us cope with the emotions that arise during this strange and stressful era.